Alright, Stuart, so we're just getting started in your knee here. This is the medial compartment. Get our flow going here a little bit better. So this is the tibia down below, femur up above. Just some real early softening in that cartilage. Just some early wear and tear, nothing major. This is the medial meniscus. That all looks good. A little bit of scuffing underneath it there, but no real tears, certainly. Nothing that I think would be clicking or catching. Get our flow going a little bit better again, and then look at this meniscus up in the front. And that looks great too. So then we'll take a look in the center of the knee here. Now this is your ACL. We're going to bend it down to about 90 degrees. And the ACL had an injury to it right here. So normally this ligament runs from the shin bone, which is down below, through this notch in the femur, this U-shaped kind of hole in the center of the femur, and attaches way up here on the what we call the lateral wall of that notch, and this is where it's pulled off. You can see kind of a scar ball of ACL here, and normally we should see a nice graft or a nice ligament running all the way up to here. So that's your tear. This is your PCL over here. It's behind this layer of synovium, but we can feel it, and we know that your knee is stable with the PCL. We're going to check behind over into the lateral side of the knee now. And this view also gives us a good look at that ACL tear. You can see how that ligament is pulled away from the bone there. We'll drop our probe over to the outside part of the knee. I think this is where you were feeling more of the clicking, so we'll look real closely again here. So this is the lateral meniscus. That all feels good. Popliteus tendon back there, usually we can see a little bit better. There we go. And sure enough, you were right, there is a tear. So this is the lateral meniscus, and it's a tear on the undersurface. You can see how the fibers look real rough back there. We'll get a picture of that. Let's see if it goes all the way through. I sure don't feel it on the top side, so that's good. Over here it looks really good. And then up in the front it's fine. So it's really just back in the back. Looks like it goes from way over here. There we go. So this is one that we can, it's a little bit borderline because like we talked about, the meniscus doesn't have a real good blood supply. But I think because it doesn't go all the way through, it's probably relatively stable. And when we do an ACL reconstruction, there's some bleeding in the joint, and it stimulates a healing response, and that may help this heal. We can try to help it a little bit further along by putting a stitch or two in it across the back here. So I'll show you how we do that also.